We have talked about the first trimester, we've talked about the second trimester. Now it's the time for us to talk about the third trimester. Now it's the time for us to talk about what I experienced in the third trimester. And was it fun or was it not? Okay, good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today, we're going to be talking about the signs and symptoms of the third trimester, and I'm going to be sharing my own personal experience with you. I'm going to be telling you the duration of the third trimester. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification button so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Like I earlier said, today we're going to be discussing about the third trimester. The third trimester usually lasts from the 28 weeks of pregnancy till when you put to bed. So even if you put to bed at 36 weeks, that is the end of your third trimester. But at 36 weeks, your child is considered preterm. Your child is considered full term when that baby is delivered from 37 weeks. From 37 weeks, your child is considered a full-term baby. Your child is considered a dope baby. Your child is considered ready to be put to bed. But less than 37 weeks, your child is considered as a preterm. There's nothing bad in giving birth to a preterm babies. For those that have not watched our videos on preterm, for those that have not watched our video on the date of birth of preterm, you can check the link in the description box below to get an insight. Like I earlier said, a full-term baby is a baby that is delivered as from 37 weeks. And research has shown that only 5% of women give birth to their child on their EDD. That's their expected date of delivery, which is 40 weeks. Only 5%. So if you didn't give birth on the 40th week, it's okay, it's normal, it's cool. Only 5% of women usually give birth on their expected date of delivery. So I'm going to be sharing with you the signs and symptoms, what I battled with in my third trimester. The first one is heartburn. Yes, I battled with heartburn. I consulted my GP and they gave me some antacid. So this antacid will help to neutralize the acid. So during this process, I was having heartburn, especially after eating and also at night. Like I feel my chest burning after eating. I feel the heartburn and it's not something I really like experiencing. But after consulting with the GP, they gave me a good antacid and that actually helped a lot in relieving the heartburn and also in relieving that pain. And also, what I experienced in my second trimester was anxiety. I was really very anxious. At this phase, I was thinking about, how's my child going to look like? Is she going to be black? Is she going to be fair? Is she going to be tall? Is she going to be tall? Is she going to come out with congenital abdomen? These are the negative thoughts and positive thoughts that keep coming. I don't know if you have been pregnant and you've experienced it, you can drop in the comment section. In the third trimester, I was really worried about my child. I was really worried about how she was going to look like. I was really worried about her outlook. I was just like anxious. I really wanted to see her. So because of that anxiety, because of that worry, I was having insomnia. I could not sleep. Yes. She was my first child. So I was having insomnia. I battled with insomnia during my second pregnancy. And I've heard a lot of women battled with that. How I was able to deal with that is that in terms of the being anxious and worried, when it comes to being anxious, those thoughts kept coming. How is your child going to look like? I just kept making the declaration, I'm going to deliver successfully. The child is going to come out well. I started saying positive things. I started declaring it upon my life. Yes, I started saying positive things against the negative thoughts that was coming to my mind. Because anxiety can lead to insomnia. So while I could not sleep, I was trying to do one or two things online, trying to do some work, trying to do some project work, trying to sort out one or two things. So this kept my brain busy. This kept my mind busy and diverted my attention from the negative thoughts. So that was how I was able to deal with anxiety. I was not able to deal with insomnia personally because I was keeping my mind busy by keeping my brains busy. So I was awake most of the times at night. Then during the day, I sleep. Awake at night, sleeping during the day, so it's altered it. So most people believe that that insomnia that happened at night is preparing you for your baby. So your baby you will be able to wake up at night to feed your baby, because that is what normally happens when the baby is born. You are always awake at night to like give attention to this child. So insomnia, the insomnia I had in my third trimester is actually helping me now. In quotes, I may say, but the fact is, sleep is very, very important. Like I earlier said, sleep is very, very important. There are other signs and symptoms you are likely going to be experiencing in the third trimester. For some, they experience shortness of breath. I experienced it, but it wasn't really very obvious. All I just have to do is to put some stack of pillows at my back, so it keeps me up and it prevents my diaphragm. It prevents my abdomen from pressing on my diaphragm, so I was able to manage it effectively well. Some people experience shortness of breath. So people have itching skin. Their skin becomes itching as a result of like it's stretching, so it becomes itching. But I didn't really experience itching skin during that period. And also there was frequency in micturition, like frequency peeing. You are always peeing, going to the toilet. It's normal during the third trimester, in the sense that the baby, especially when the head has descended, the head is not down, it's pressing on the bladder. So any small urine, you get signal and you always want to go to the toilet. And that can also cause insomnia, because when you are sleeping, you start having this urge to urinate. You don't want to wee on your body. You wake up and go to the toilet and pee. So frequency in micturition is also a sign in the third trimester. Then also headache. Some people have headache. Some people have swollen legs and feet. So if you're having headache, you're having swollen leg, please and please try and see your midwife, try and see your GP, so that they check your blood pressure. That can be a sign of preeclampsia. That can be a problem that has to be sorted out as soon as possible. So if you're having swollen feet, you're having headache, please see your doctors. Then also backache, back pain at the back. You start feeling some back pain. Oh, you are not comfortable, you keep moving out. So that is also a sign of the third trimester. The next sign I will have to share with you is feeling hot. Like most pregnant women, close to the end, like the third trimester, they feel hot, they are sweating, they are not comfortable, they have to bathe like twice a day and all that to make them feel comfortable. Then also urinary tract infection can be common during this period. During the third trimester, you might be feeling dizzy, weak, fatigue. So that was why I said that the second trimester is the trimester that has a lot of energy. So when you get to third trimester, that first trimester mood might start coming back again, feeling weak, feeling dizzy, feeling tired, and like, oh, frustrating. And also mood swing. Mood swing is common. This minute you are happy, the next minute you are angry. This minute you are happy, the next minute you are sad. So these mood swings come in and come out in the third trimester. Then also sore and leaky breast. Some people notice that their breast milk has started dropping during this third trimester. Sore breast, they are pain, like I'm feeling pains in my breast, like some start dropping mix. So during this period, it's advisable, if you can express the breast milk. If it's coming out very well, you express the breast milk, put it in the syringe and keep it in the fridge. It's not going to spoil. So breast milk can be frozen and kept in the fridge for long. It's not going to spoil. It's frozen and kept in the freezer, it's not going to spoil. It can also last in the fridge for some time. It's not going to spoil. I'm going to make a video about frozen breast milk and breast milk in the fridge soon. So you can actually express the breast milk down for your baby, so your baby gets it. You know, the first milk from the breast, which is colostrum, is very important for your baby, so you don't have to waste it. You have to give them. It has a lot of antibodies in it. So that's one of the signs. Some people experience sore and leaky breast. Then also some people have hemorrhoid, constipation during the third trimester. So when you are battling with this, please and please consult your midwife or your GP or your doctor. Then in the third trimester, what is very, very common is Braxton Hicks contraction. Braxton Hicks contraction is a first contraction that prepares you for labor, first contraction that prepares you for delivery. It's first contraction in the sense that it is not the main thing. Some Braxton Hicks contraction is not painful compared to the labor contraction that you have. So in Braxton Hicks contraction, there's tightening of the abdomen. It's already like it's preparing you. The abdomen is tight. When you put your hand, you see it's just tight, but it's not painful when compared to the labor contraction, the recontraction that tells you, oh, the baby is knocking at the door. So that's all I have to share with you. Is that all I have to share with you? Let's check. Yes, that's all I have to share with you about the third trimester. For those that have been pregnant and would like to share some signs and symptoms they experienced during the third trimester, you can drop in the comment section and we will be glad to learn from you. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary as usual saying thank you. Bye, and see you in our next video. Bye.